While I recommend trying to address the cause of your hyperthyroidism, while doing this, it's important to safely manage your symptoms. Every now and then, I'll have a patient who isn't doing anything to lower the thyroid hormones, which is a big mistake. Another concern is someone who is doing things to lower their thyroid hormones, yet their thyroid hormones remain extremely high. This, of course, also is a concern, and I will address this towards the end. So, first, let's briefly discuss some of the common signs and symptoms of hyperthyroidism. So, some of them include increased resting heart rate, palpitations, tremors. Not everybody experiences weight loss, but a lot of people do. It's pretty common with hyperthyroidism. Uh, Having anxiety, insomnia, hair loss, skin issues, thyroid eye disease. Again, not everybody, but a lot of people with hyperthyroidism, specifically Graves' disease, have thyroid eye disease. So now let's talk about some of the different consequences of unmanaged hyperthyroidism. So number one is the stress on the heart, and that's arguably why most people end up taking antithyroid medication or a natural approach. I'll talk about both options. When I dealt with Graves' disease, many of you already know that I took more of a natural approach when it came to managing the symptoms. But a lot of my patients take antithyroid medication, sometimes beta blockers, and while still addressing the cause of the problem. But like I said, a big concern is the stress on the heart. When someone has a resting heart rate in triple digits, so if it's 110, 120, sometimes a lot higher, 140, 150 beats per minute. We'll talk about resting. I mean, resting heart rate should be in the low 70s at the highest, and ideally a little bit lower than that. Like I like to see mine in the mid 60s. And some people are, I mean, if someone's a marathon runner or does triathlons, they might see their resting heart rate in the 40s or 50s. But either way, you don't want that resting heart rate to be extremely high. Heart palpitations can be scary. Again, the palpitations themselves aren't really causing harm, but the increased resting heart rate could, and that could lead to arrhythmias, atrial fibrillation. Again, could be scary. And so, yeah, that's one big reason for managing your symptoms, for to do things to lower the thyroid hormone, just because that one of the main consequences is the stress on the cardiovascular system. Consequence number two, decreased bone density. So this is more difficult to measure, just because when someone has a elevated heart rate, it's pretty easy to either check your own pulse, or if you have a blood pressure machine, or you go to a local pharmacy and they have an automated blood pressure machine, you could easily check your blood pressure, which usually will also check your resting heart rate. But when it comes to the bone density, how do you know the impact that hyperthyroidism, that elevated thyroid hormone levels, will have on your bones? You can't. Well, I mean, of course, you get a bone density scan, but even if you do this, you're not going to do this on a regular basis. You're probably going to do this one time, at least in the immediate future, and then maybe you'll eventually retest it. There is a marker on a comprehensive metabolic panel called alkaline phosphatase. Alkaline phosphatase is commonly increased in those with hyperthyroidism. And the reason for this, it's not the liver. Some people think that alkaline phosphatase is elevated because of problems with the liver. Usually that's not the case. I would focus more on the AST and ALT. There's also a marker that's not part of a metabolic panel called GGT. That's a good idea to take a look at as well. But alkaline phosphatase, when that increases in hyperthyroidism, that's usually related to the increased bone turnover. And this also increases in children. Like, it's higher, the reference range is higher in children. And that's because the bone turnover is greater in children because the bones are growing. But in an adult, this shouldn't be the case. So if someone has an alkaline phosphatase of 150 or 200 or 250, again, usually is going to indicate in the person with hyperthyroidism that they have the increased bone turnover. And a consequence of that is that over time, the person can develop osteopenia and even eventually osteoporosis, which obviously this is not a good thing. So you want to do things to lower thyroid hormone levels to help with this. And yes, you could also do weight bearing exercise and eat a healthy diet, have healthy vitamin D levels. But if you don't do things to lower the thyroid hormone levels, even if you're doing everything else, it very well can have a negative effect on bone density. Consequence number 3 of unmanaged hyperthyroidism, extreme weight loss. So when I dealt with Graves' disease, I lost 42 pounds. Initially, I was trying to lose weight. I was 182, I believe. That was the most weight I've ever been. And for me, that was higher than I wanted to be. I usually like being around 165, max 170. And so I was attempting to lose weight at the time, which I did, but eventually my dieting and detoxifying eventually was the hyperthyroidism that caused me to lose a lot of weight. Again, I dropped down to 140 pounds, which for me is not desirable. So again, 42 pounds total, down to 140 pounds. Again, that's extreme weight loss. And again, everything's turned out okay. I see this a lot with patients. I mean, there are some people that gain weight with hyperthyroidism, and I'm not going to get into that here, but a lot of people do lose weight. And even though I'm one of the few men who developed hyperthyroidism, most of my patients who develop hyperthyroidism are women. And sometimes they're quite petite to begin with. So someone might be 110 pounds and losing 20, 25 pounds, and they're really concerned about wasting away. And it is a concern. I mean, in most cases, it's not going to get to the situation where it's an emergency and someone needs to go to the ER because of the weight loss alone. But again, I can understand it being really scary. That's why you want to be under the guidance of someone, at the very least an endocrinologist. But I mean, if you're seeing an endocrinologist, you're probably taking anti-thyroid medication of some sort, whether it's methimazole or PTU. And that in turn should lower the thyroid hormone levels, which over time should help with the weight loss. If someone balances the thyroid hormone levels and they are still experiencing weight loss, and they're probably something else is probably going on, such as a gut issue, some type of malabsorption problem. But in most cases, when someone is losing a lot of weight and they have hyperthyroidism, it usually is related to the hyperthyroidism itself. But there's no rule that says that you can't have more than one problem going on at the same time. Consequence number 4 of unmanaged hyperthyroidism, insomnia. So having elevated thyroid hormone levels can make it more challenging to sleep at night. And I mean, sometimes it's the palpitations, just having the heart palpitations. I remember, again, when I dealt with Graves' disease, experiencing those palpitations and just trying to get sleep. So that could be challenging for some people. And, obviously not getting sleep, if you're only getting 4 or 5 hours, and some people getting less than that, that's not a good thing when it comes to your health. So that's another consequence of unmanaged hyperthyroidism. And then the 5th and final consequence I wanted to talk about, thyroid eye disease. Now, this is a little bit different because this doesn't really relate to managing the thyroid hormone levels, like lowering the thyroid hormone levels. This is autoimmune. This is the immune system attacking the tissues of the eyes. So it's more so managing the autoimmune component, addressing that autoimmune component. So again, this is a little bit different, but I did want to bring it up because there are still some people with Graves who decide not to take the medication and really aren't doing anything to improve their health. And over time, that could either lead to thyroid eye disease if they don't have it, or if they have thyroid eye disease, will potentially worsen over time. So next question you might have is, how should you manage your hyperthyroidism? How can I manage hyperthyroidism? And not going to get into great detail. I will talk about it, of course, here, but I do have other episodes as early as episodes number 2 and number 3 I have episode number 2 where it talks about conventional treatment options, conventional symptom management options for hyperthyroidism, such as anti-thyroid medication. And then episode number 3 talks more about the alternative options, such as bugleweed. And so you could visit savemythyroid.com/2 or savemythyroid.com/3 if you want more information. Again, I'll talk a little bit about it here, though. So anti-thyroid medication, methimazole, PTU. If you're overseas, maybe you're taking carbimazole, which converts into methimazole. Again, a lot of people don't want to take anti-thyroid medication because side effects are normal, but everything comes down to risk versus benefits. So again, I did not take anti-thyroid medication when I dealt with Graves. So I understand if someone absolutely does not want to do it, but there's a time and place, especially if someone tries the natural agents, which I'll be talking about next. And if the natural agents aren't effective, then I mean there are other options as well. But the anti-thyroid medication is something to consider in the case where nothing else is working essentially. Now, if someone's experiencing side effects to methimazole, sometimes PTU will be better tolerated. Sometimes not. Sometimes a person will react to both methimazole as well as PTU, and then again, they might need to look into other options. And when someone does react to methimazole and PTU, many times the endocrinologist will really pressure the person to get radioactive iodine and thyroid surgery. But there are other options. One option is a beta blocker. Again, not ideal to be on medication, but there's a time and place. And that's why I'm talking about it here. So propranolol is commonly recommended as a beta blocker. There's also metoprolol and atenolol, but typically they'll recommend beta blockers that not only directly could lower the heart rate, but also could, some of the beta blockers like propranolol will inhibit the conversion of T4 to T3. So essentially it's lowering T3 levels, which is the active form of hyperthyroidism, or which is T3 is the active form of thyroid hormone, is what I meant to say. And so if someone can't take anti-thyroid medication, taking a beta blocker, again, not a long-term solution, but if it's a choice between taking propranolol or receiving radioactive iodine thyroid surgery, I definitely would prefer to take propranolol personally. That's my choice while trying to address the cause of the problem. So there's the medications, and then there's the natural agents. So when I dealt with Graves' disease, I took an herb called bugleweed, which has anti-thyroid properties, and then I took motherwort, which kind of like a natural beta blocker, so that could help with the cardiovascular symptoms associated with hyperthyroidism. Not everybody has to take both bugleweed and motherwort. You could certainly, I started with bugleweed actually, and then I was still having some heart palpitations, so I added motherwort a few weeks later. L-carnitine in higher doses blocks thyroid entry into the cell, and by higher doses, according to the literature, 2,000 to 4,000 milligrams of L-carnitine tartrate. So that's an option to consider. Lemon balm has a calming effect. There are also some evidence that it could maybe help with the TSH receptors, help prevent the binding of the TSH receptor antibodies to the TSH receptors. I don't find lemon balm to be nearly as effective as bugleweed. So, and I can't say like I see a big change in the autoimmune component, like in the TSI antibodies and those that take lemon balm. But if someone's having issues sleeping or a lot of anxiety, I think taking lemon balm at night could be beneficial, or drinking some lemon balm tea. Lithium orotate also could potentially help. Now, lithium carbonate is a prescription medication. Lithium orotate is something that does not require prescription. So, what should you do if you choose to take a natural treatment approach, a natural symptom management approach for hyperthyroidism, and your thyroid hormones remain high? It depends on the severity of the thyroid hormones. I mean, first of all, we want to make sure that someone is taking good quality herb and a healthy dose. There's not a lot of brands of bugleweed out there. It's not like getting vitamin D. I mean, there's a limited number of brands, but still there are different potencies, different qualities. So like when I dealt with bugleweed, I took the brand Medi-Herb. Some people take Herb Farm, which is readily available, and the quality is good. It's just that the potency is low, which for some people is fine. Not everybody needs high potency bugleweed, but some people will just follow the instructions and they'll take like a dropper full like 2 or 3 times a day, and that might not be enough. Others will take combo formulas. Like example, there's one thyroid calming formula. There's also ThyroSoothe that's out there. So let's take the combination formula, but even though it sounds good because it has bugleweed, motherwort, and lemon balm, bugleweed is the main herb that helps to lower thyroid hormones. So by taking a thyroid, like a combination formula, there's not going to be as much bugleweed because, again, it also includes motherwort and lemon balm. So some people need to take the bugleweed separately. And so that could be a reason. Like if someone's taking, again, a dropper full of thyroid calming formula 3 times a day, and maybe they feel a little bit better, but their thyroid labs, when they retest, doesn't look much better. It could be that you need to take bugleweed separately. Also could be, even if you take bugleweed separately, you might need a higher potency bugleweed. And then again, there's L-carnitine. So some people, I did not take L-carnitine when I dealt with Graves' disease. So again, not everybody needs to take bugleweed and L-carnitine, and I don't recommend both of those to all my patients with hyperthyroidism. But if someone is taking bugleweed alone and it's not helping, then they might want to combine that with L-carnitine. Again, taking higher doses of L-carnitine according to the literature. And then there's cholestyramine and low-dose naltrexone. So I also have podcast episodes, separate episodes where I talk about these. And these are medications. LDN, though, which is low-dose naltrexone, doesn't have the same side effects as antithyroid medication as well as beta blockers. I mean, with any medication, there's potential for side effects. I mean, heck, even with natural agents, there's potential to have side effects. I mean, most people tolerate bugleweed well, but every now and then there'll be someone who doesn't tolerate bugleweed or other herbs well. So you could react to anything, but LDN is better tolerated than methimazole and PTU in most cases, as well as beta blockers. So an LDN modulates the immune system. When it works, it could work really well. Problem is, I find it to be hit or miss. So, I mean, but still, if someone is unable to take antithyroid medication and if the natural agents aren't working, then they might want to consider trying LDN. And low-dose naltrexone LDN usually is pretty easy to get a prescription for. And the reason for that is, at least in the United States, you could schedule a consultation online, like a telemedicine call with companies such as LDN-Direct, which should be ldndirect.com, I believe, or low-dose ldndoctor.com, I think is another website. And that's where, again, you could schedule an appointment with someone, a practitioner who pretty much recommends LDN to everyone they speak with. And so that's one way. There's also ldnscience.org, I believe. And this could be helpful if you're in a different country, where you could search for a local practitioner who prescribes LDN. You could also go to a local pharmacy and ask them. I mean, the pharmacy, of course, fills the prescription. So you could ask a local pharmacist if they know of anybody who prescribes LDN. So that's another way to try to find someone who's local. Cholestyramine is a binder. It's not specific for hyperthyroidism, but there is some research behind it that shows that it can bind to thyroid hormone levels. And I've had a few patients, again, not a lot over the years, but I've had a handful of people to take cholestyramine who reacted to the antithyroid medication and just didn't get the results they were looking for with the bugleweed and the L-carnitine. And I think pretty much in all situations, again, small sample size, but it did work. And I've had a few cases where it saved someone's thyroid, where otherwise they probably would have gotten radioactive iodine thyroid surgery because their endocrinologist was pressuring them. And I do have an article on it. I have a podcast episode, but I don't recommend necessarily showing my article or asking your endocrinologist to listen to the episode. If you are in a situation where you think you might need cholestyramine, show them the research. So if you go to naturalendocrinesolutions.com and type in cholestyramine, or again, I have a podcast episode on that. And if you don't know how to spell it, just visit the show notes, savemythyroid.com, and you can check out the show notes, and it'll be spelled there. So I won't spell it right here, but But anyway, if you show them the research, they'll be more likely to recommend it. There's like journal articles. If you show them my blog post, they may or may not, but they are more likely to dismiss it just because there's a lot of things out there on the internet. And just because I do my research, but they have no idea that I do my research and I know what I'm talking about. So, but if you show them the journal articles, they're more likely to write a prescription. I mean, it's not the most convenient medication to take because it's in powder form and you need to take it away from food and supplementation. So I do want to prepare you for that if you do need to take it. But if I had a choice to take cholestyramine, if the only three options was cholestyramine, a thyroidectomy, or radioactive iodine, I would choose cholestyramine while again addressing the cause of the problem. And then I did mention thyroid eye disease earlier. So again, I have other episodes where I talk about thyroid eye disease, and it really comes down to addressing the autoimmune component. Just like Graves' disease, thyroid eye disease is an autoimmune condition. And I mean, for severe cases, sometimes conventional treatment is necessary. But in mild to moderate cases, there are things that you could do naturally. I mean, even in severe cases, you might be able to potentially avoid surgery. There's also, I know there's Tepezza out there, which can help. It also has side effects, but yeah, it is more challenging when someone has severe thyroid eye disease compared to when it's more on the mild side or even moderate. So that's pretty much all I want to cover here. I hope you found this information to be valuable when it comes to consequences of unmanaged hyperthyroidism. And of course, stay tuned for more valuable information related to saving your thyroid.